welcome to this important event. The WHO has reserved 30th of January of every year for the celebration of the World Neglected Tropical Diseases Day, NTDs. And this year, 2022, is the third consecutive year the world is celebrating. The State Ministry of Health, on behalf of the Zamfara State Government, under the leadership of His Excellency Honorable Bello Muhammad Mutawalla Maradun, is also joining the global community to commemorate the celebration of the third World NTD Day. The purpose of this day, according to WHO, is to mobilize political will and secure commitment to eliminate NTDs as well as alleviate the sufferings of those affected by the tropical diseases through prevention. The NTDs, mostly parasitic infections, are the major causes of preventable blindness and disability. They threaten more than 1.7 billion people worldwide who live in the poorest communities, making them vulnerable to the mild and severe lifelong impairment. These diseases blind, disable, and disfigure people, taking away not only their health, but also their chances of staying in school, earning a living, or even being accepted by their family or community. Those affected are usually stigmatized, and that alone can have a devastating impact on them and their families. Nigeria as a whole, and Zamfara State in particular, is at risk of contracting one or more of the NTDs. The NTDs are trachoma, a blinding disease. 7 LGAs in Zamfara State are under control. 2 river blindness, with 6 endemic LGAs are no longer at risk. 3 lymphatic filariasis, where 14 LGAs are endemic, and more than 4 million people living in the state are at risk of the disease. Number 4, bilharzia, where 14 LGAs are endemic, and more than 1.1 million people, 1.1 million school-age children are at risk. Soil-transmitted helminths, that is intestinal worms. Only 1 LGA in the state, that is Birnin Magaji local government, is at risk. At this end, I'm aware that not much has been achieved with regard to eliminating NTDs over the years, not only in Zamfara State or Nigeria, but globally. However, Zamfara State Government provides enabling environment and support for the conduct of annual mass drug administration, MDA, which is vital to elimination of NTDs. The state government, through the Ministry of Health, also launched a project called Aliyu Abubakar last year, a program that conducts free medical care and hydrocell viewer surgery to underprivileged men across the state to alleviate their sufferings. Not only that, The government also contributed by augmenting cost of drugs and to patients having similar operations conducted by our partners. Having similar operations conducted by our partners in the state. I want to assure you, the world and the people of Zamfara State in particular, that the administration of His Excellency, the Executive Governor of Zamfara State, Dr. Muhammad Bello Mutawalla Muradun, Bardan Kasar Hausa, is committed to ensuring provision of adequate water supply across the state, improved environmental sanitation and hygiene, prompt rendering assistance and relief materials to victims of banditry through newly established Ministry of Humanitarian Services, as well as reductions of poverty through youth empowerment and employment, which their neglect are major causes of the NTDs. Above are a silent achievement of the Zamfara State Government towards control and elimination of NTDs. Therefore, the Ministry of Health, under my leadership, it resolved to show commitment towards the control and eradication of NTDs in the state. It's the first state to sign MOU Partners Funding Agreement, PFA, on conducting trichiasis surgery with our partners, Site Savers, and also the first to sign that of elephantiasis prevention treatment. Signing the PFA is a prerequisite of commencing any intervention by the partners in the state. Finally, I wish to express my profound appreciation and gratitude to our partners, particularly Site Savers International, working in the state, supporting us in fighting and control of NTDs for their transparency, accountability, and commitment. I pray they continue, and also wish to use this opportunity to call on our local government, sole administrator in the state, to include their budget funds in NTDs. No matter how little it is, it will go a long way in reducing sufferings for those affected by neglected tropical diseases in the state. I encourage every one of you, every one of us, to ensure taking drugs for the control of NTDs, Mectizan and albendazole, that will be distributed house to house very soon in the state. Thank you.